Hi, my name is Steve Tolles, and I'm a senior housing and care advisor. And I help seniors, frail elders, and their families determine care needs and find appropriate care environments for themselves or a loved one. Or I help them stay in their homes with referrals to in-home care companies. The reason for this video presentation is my desire to have a conversation with you today about just one of the care and housing options available, and that is the adult family home. So stay tuned. If you're considering care and housing options for yourself or a frail elderly parent, parents, or a loved one, then it is important to at least consider an adult family home as a potential option. The official name of these communities in the state of Washington is adult family home, but they're also known as adult care homes, group homes, or residential assisted living homes. These care environments are typical homes located in residential neighborhoods and can legally house and care for up to 6 residents, patients, or clients as they're sometimes called. They are generally independently owned and are for-profit businesses, although a few of them are incorporated as nonprofits. Now, some owners or providers own multiple homes, but most homes are standalone, and often the owner-provider lives in the home and does much of the caregiving. These homes are licensed by the Department of Social and Health Services, commonly known to most of us as DSHS. And they're licensed on behalf of the state of Washington. Not every state has these specific types of care facilities, and if they do, they often handle them differently. Generally, if you're driving around any neighborhood and notice a wheelchair ramp leading to the front door, there's a very good chance that this home is an adult family home. Although there are some homes that are built as an adult family home from the ground up, most are existing homes that have been remodeled according to specifications and requirements laid out by DSHS. One of the allures of the adult family home is that it mirrors neighborhood living because it is actually part of a residential neighborhood. Often residents of these homes have barbecues and other outside activities during times of nice weather, giving them a feeling of comfort and familiarity that can be more difficult to accomplish in a much larger setting. Adult family homes come in all sizes and configurations, as unique and diverse as the neighborhoods in which they exist. Some have shared rooms available that help some with resident costs, but most have private rooms for their residents, and some even have private baths or half baths for each room. Most have a central shower because most of the residents need some assistance in order to be safe when showering. There are homes that are very upscale and opulent, and homes that are very modest and more typical of the home most people come from. I've found that it isn't so much the opulence of the facility that tops people's list of priorities. In fact, most people are generally attracted to the type of environment in which they are used to living. The biggest issue in choosing a home is the quality of the care and the people who give the care, as well as the other residents that are currently living there. There are several factors involved in choosing an adult family home, but first I'm going to talk about the reasons why someone might choose this option for care and housing. The adult family home environment is a small environment, and therefore it is conducive to providing intimate personal care on demand. It is one of the better options for someone who should not be left alone for periods of time and who may not be able to activate a pendant for help. Also, there are care needs that require an instant response that can't be accomplished if someone is in an apartment alone, that requires a certain amount of time to respond. It is also appealing for those who would do better with having the same few caregivers helping them out. When a loved one is struggling with memory issues, the fewer changes in personnel, the better. Generally, the caregiver to resident ratio in this environment is 1 caregiver for 3 or 4 residents during the day and 1 for 6 during the night. Most often, wake staff at night is based on the specific need of the residents at the home, but all homes have call buttons and/or motion sensors or floor alarms to alert a caregiver if the resident attempts to get up at night. Since most accidents happen at night, there's a strong focus on assuring a safe outcome for someone who needs to use the bathroom. The most common residents of adult family homes are those with dementia, but there are many homes that work with stroke victims, MS victims, ALS victims, Parkinson's, hospice patients, trauma victims, and anyone who needs a very high level of physical care, including two-person transfers, lift transfers, and insulin shots. Also, there are homes that specialize in all ages of disabled or developmentally disabled. If someone is a chronic wanderer or elopement risk, or they have behaviors that put themselves or other residents at risk, then generally an adult family home may not be the best option. There are a few homes that have a secured premise and can handle the wander risk, but most homes stay away from residents who exhibit those behaviors, often because a caregiver may not be available to leave the other residents to go after the person who eloped. I remember when I moved an 85-year-old lady with dementia into a home within an hour of the time she moved in, she bolted out the front door and literally ran down the middle of the road. It was not an appropriate environment for her specific behaviors. Often in these homes there is a family-like atmosphere that sometimes includes children of all ages as well as pets. Over time, the caregivers and providers become like family that includes the immediate family of the resident. I've observed many examples of tenderness and caring between the caregivers and residents. Often so many of our seniors find themselves more and more isolated over time, and the lack of physical contact takes its toll. I've seen miracles occur because the senior finally got some much needed attention, companionship, healthy food, and consistent care and caring. A few years ago, I found a home for a couple where the husband had been his wife's caregiver over a number of years because of a devastating stroke that rendered her unable to speak and in need of lots of assistance. The husband started having TIAs and serious balance issues and ended up in the hospital. He was getting worse and worse, and he could not take care of himself, let alone take care of his wife. I was able to move both of them into an adult family home where they settled in nicely without the stress of him providing care. A year later, I was at that home with another client, and the husband came waltzing out of his room all dressed up. I asked him where he was going, and he said, "I'm going out to try and get my driver's license back." And off he went. Now granted, it was an unusual case, but it was an example of what the right care environment can accomplish. Just a year before, we thought he was going to need care for the rest of his life. Now he's back and feeling good about himself. He had that "I'm healthy and happy" bounce to his step. I realize that this is the exception in many ways because of the dramatic change, but often the change is much more subtle in the general look and feel of a loved one who's getting what they need to have the highest quality of life possible given their condition. That doesn't mean these care environments are for everyone, but a good home for the right patient can be a great blessing. There are 6 criteria when considering a home, and they are as follows. Number 1 is the level of care available, which includes staffing and support as well as the attitude of the owner as it relates to their staff and residents. Number 2 is the environment, which speaks to the quality of the home itself and the other residents that are at the home. For example, someone who is alert and oriented needs other alert and oriented residents. Number 3 is the location in relationship to the immediate family. Does the family live close enough to have a significant interaction and involvement in their loved one's care? Number 4 is the reputation of the home, which is about the experience other residents' families have had with their loved one who was or is a resident. Number 5 is the ability of the owner to work with a difficult situation and problem solve in collaboration with the family if a resident is not fitting in. This can be a huge factor in having a positive result. Finally, number 6 is the cost, which is not just about the initial monthly fee, but also about the willingness of the home to accept Medicaid at some point if the resident runs out of funds. The decision is both objective and subjective because there's a feeling when you are in the right home that is real and profound. Often people just seem to know that this is the right place. One of the attractions of an adult family home is the COPES option. COPES is the Medicaid program with DSHS that is specifically geared to assisted living communities and adult family homes. To qualify for COPES, an individual must have an income of less than $6,400 a month and $2,000 or less in assets, and their care and housing expenses must exceed their income. If someone has a spouse, then the couple can have up to $50,000 in assets, not counting a home, car, and personal effects. In that case, one of them could qualify for COPES. Most but not all adult family homes will accept COPES, and most that do require some period of private pay before the resident goes on COPES. The time periods vary anywhere from 6 months to 5 years. Most seem to want at least 1 year. Very few assisted living communities today will accept COPES, so often the adult family home is the only option if running out of funds is a risk. When a resident moves into a home, they're able to keep their own doctors, but a lot of homes have visiting doctors and/or prescribing nurses that care for the residents. They bring podiatrists for foot care and will accept physical therapy as well. In addition, hospice is accepted in most homes. To enter a home as a resident requires an assessment by an independent and qualified RN. The RN has to be approved by DSHS for the purpose of these assessments. The assessment usually costs an average of $350 and is a comprehensive report on the resident's condition, including all medical information and prescriptions, as well as a very specific plan that includes appropriate interests and activities for the resident. Often we recommend that the family get the assessment before we go and start looking for a home, if a home is the preferred option. This way we can get an accurate monthly cost from the home when we are touring. Not long ago I got a call from a gentleman who wanted me to find a home for he and his wife. The man was 88 and in very good shape. He was fully alert and oriented and very physically active. They lived in an apartment and his wife was suffering with Alzheimer's, and he had been her main caregiver for the previous several years. When he specifically asked for an adult family home, I was scratching my head and wondering why he wouldn't want to be in a larger assisted living community where there was more activity. He told me that he thought about it, and he decided he wanted to be in a place where he could come and go and not worry about his wife's care and well-being. He said he would like to be active again at the senior center, and if they were in an apartment, he could not leave her alone for periods of time. He wanted a nice master bedroom suite with a private bath and some other residents who were also alert and oriented. We found him a very nice home just a few blocks from his daughter. Because he didn't need any care, he was able to move into the home as a boarder and only pay a small amount for room and board as a seventh resident. Homes are allowed one resident boarder as a seventh person. It has worked out very well for him. Now generally I tell people that a retirement community that offers assisted living is less expensive than an adult family home if the care needs are low, and is often more expensive if the care needs are very high. The range of costs for a home is between $3,000 a month and $7,500 a month, depending on the home and the needs of the resident. The vast majority of homes have a range of $3,500 to $6,000 a month, and there are some that are simply charge a flat rate regardless of care. The average cost of a home for most residents is between $4,000 and $5,000 a month. The residents sign a month-to-month contract, so there are no long-term commitments required. Adult family homes are also covered by most current long-term care policies, but it is important to read each policy because some of the older ones specifically exclude them. There are no community fees, entrance fees, or other fees to get into a home. The only upfront cost is the nurse assessment and the first month's rent and care. I have observed hundreds of homes over the years and gotten to know the owners individually, and I can honestly say that the vast majority of those who own and run their homes are hard-working people who are not only doing this work to make a living, but also and more importantly because it is a calling of their heart to care for others. I have witnessed owners who have a great affection for their residents and really care about them. There's often tenderness and a sense of appreciation for these frail elders who are in need of serious attention. I really appreciate the dedication and commitment that is at the heart of the work that they do, and I feel privileged to be able to support their work and to witness it. Adult family homes definitely have their place, along with assisted living retirement communities and skilled nursing in the care and well-being of our elders. Since there are close to 2,000 adult family homes in the Puget Sound area, finding the right place without the support and assistance of a Choice advisor can be a daunting task. Our agency is committed to having the most up-to-date information and personal experience of these homes. And we make the job significantly easier by removing much of the stress in this process. We are contracted with over 90% of the retirement communities and adult family homes and are able to offer both options for consideration. If you have any questions or want to know more about the various options available, please call me directly at 425-691-7031 or email me at steve@choiceadvisory.com. You can also call our main office between 8:30 a.m. and 8:30 p.m. 7 days a week at 1-800-361-0138. I hope you enjoyed and appreciate this presentation. Feel free to forward it to others who might find value in it. Thank you for watching, and please enjoy the day.